Most often it's from diabetes, but you're pre-diabetic, so that doesn't really make sense that it would be from that.
So you said both eyes have glaucoma damage on the optic, right?
Worse on the right eye.
Worse on the right, and the left.
Yeah. And the left eye has the swelling in the retina, and that's why that's causing some blurry vision there.
So me and my cousins were thinking it's definitely time to stop driving.
Based on her vision now, yeah, I would not recommend it.
Yeah.
So, just to show you the swelling. So, this is the right eye. There's no swelling here on the right side. You can see the left side has all this fluid. I'm not exactly sure why you have this fluid. Sometimes that dropped latanoprost can cause it.
Really?
Yes, sometimes.
I take it myself.
You do, yeah. And again, there are lots of things that can cause it. I think what we should first do is just switch you to a different glaucoma drop and see if that helps. Okay.
Which drop would you be switching her to?
So there are a few options. Do you have asthma at all? Any history of asthma? Does she take an inhaler?
My sister has asthma. Do you have asthma, Mother?
Any breathing problems?
No.
No. Okay. Then I would recommend switching her to a drop called Cosopt.
What's it called?
Cosopt.
Cosopt?
Cosopt.
Could you spell it?
Yes, COSOPT.
COSOPT?
Mm-hmm. It actually has 2 medications in one drop, so it's quite an effective drop. It's twice a day, so once in the morning, once in the evening.
What does it do differently than the other one?
It works very similarly. It just doesn't cause this.
swelling.
So I think that's the first thing to try, to take her off the latanoprost and see if this gets better, just switching the eye drops.
Mm-hmm.
Okay, so we'll send you that. What pharmacy do you want it sent to?
Does cataracts have anything to do with this?
No
Cataract.
no cataracts.
Which pharmacy?
Huh?
Where do you want the pharmacy? Can you have it delivered?
I don't think
I guess
so.
it just depends on the pharmacy.
Yes, exactly. Some pharmacies do that.
Can you send it to the Publix pharmacy?
Yeah.
I'm
Which-
not sure. Do we have an address for that? Do you know?
It's on Folly Road,
Folly Road. Let's see.
29412.
So cataracts doesn't have anything to do with this.
No cataracts. No cataracts.
I thought that was the reason that there was this fog in this.
The glaucoma.
That's the glaucoma.
And the swelling. Okay.
And the drops.
Yeah. So there are a few things going on. So you've already had cataract surgery. So
or the
once
Merchants
you've had cataract surgery, they don't come back. Okay.
both are on Folly Road.
Yeah, I know.
Okay. So drops
What's the
will
first one?
help
Rich
with this
Riverland
fogginess.
Market.
I'm
The
trying to
drops
figure
will
out
get
which
rid
one
of
is
the
which.
fog.
The drops treat
Do they have
glaucoma, so it doesn't
I guess the
actually
one is 29412.
get rid of
is
the
the one.
fogginess, but we want to see if switching the
Does it
drop
show
will
the
help the
triple?
swelling. Once the
294
swelling gets
too.
They're
better,
both 2941.
that
Yeah.
should help the vision.
And one's called the Village. What's the other one called?
One is called Riverland Market. The other one's Merchants Village.
Should do the townie.
Probably Merchants Village.
Merchants Village. Okay.
Either way, we'll just ask them, can they deliver it?
Okay.
Okay, so I'm gonna write this at the top too. So we're gonna stop the latanoprost.
How soon do you think that'll? Can we get some today to tide her over until it comes?
We don't have any.
Yeah.
No. But don't stop the latanoprost until you have the new one.
I have a question.
Yeah.
My mom's is a spouse of a vet.
Mm-hmm.
and most of her, I think, pharmacy is at the VA, right? Can't she have that sent to the VA?
I can't send it electronically, but I can print it out, and then you'd have to take it to the VA. I can't send it electronically to the VA.
I'm saying, if it goes to the VA, would there still be a charge?
Probably.
Need you
Probably not. Do you normally go to the VA?
to call my medicine at the
So
Charleston Air Force Base Pharmacy.
I don't know if I can. I don't know if I can send it there through the computer. So I might have to print it for you.
If it were sent to where we want, which is the Publix, could we then have them transferred to the VA?
I don't know.
I don't think so. I think we'd have to print it out and you'd have to take it to the VA.
Yeah.
Okay.
So I'll print it out. Okay. So this Cosalt has a blue top.
So, but that would mean more time with her not having it, right?
Yeah, so don't switch it.
Until she gets it.
Yeah. Because we want to keep treating the glaucoma.
Let's just go ahead and have it sent to Publix, because who knows how long,
Okay.
right? And then
That way you can go ahead and get it.
get it right now.
It should not be very expensive. It's,
Okay.
it should not be.
Just have it sent to Publix.
Yes,
That's
sir,
it.
of course.
Yeah.
So, okay. So we're gonna stop that drop you're using now. We're gonna start the new one. The new one, like I was saying, is twice a day, so morning and night. And then another issue that's going on is your eyes look very, very dry. The dryness can also cause some fogginess in the vision.
Mhm.
Okay, so I also just want you to start some artificial tears. That's on the sheet. This will help as well. So the artificial tears are over the counter, so you can get them when you go to Publix. Just pick up some artificial tears as well.
But for the glaucoma, you said that, what did you say that you would call it up to the base for? 'Cause
We're gonna send it to Publix so that you can go ahead and get it now, because I can print it for you too, but you'd have to take that to the pharmacy at the base.
Yeah, and right now you need to get it right away. We can always have it transferred.
Yeah, we can always have it transferred. And if you normally, do you normally go to the VA for your regular doctor?
Well, when she was driving, but now the vision's so bad.
Yeah.
But I mean, we can still get there. But
So
how soon would it? So I'm just saying, let's just get it.
them to take prescriptions, first-time prescriptions. Usually they're called. The doctors call up to them, then they call us.
Right.
That's
But-
how they do it.
But I'm saying, once it gets to Publix, then we can straighten it all out.
yeah,
We just have it transferred.
They may be able to do that. You can ask the pharmacy. I just can't send. It won't let me on the computer send it to the VA pharmacy.
Okay.
Okay. So we're gonna switch the glaucoma drop and see if that helps the swelling. Okay. And then also want you to use some artificial tears. That's gonna help as well because the eyes are quite dry.
I have some on me too.
Yeah.
In my bag.
Yeah. It also can be really helpful to get something a little more lubricating at night, like an ointment.
Like what?
And it's on the sheet. So Systane Nighttime or Refresh PM. That can be like really lubricating to the eyes while you sleep. And I think that would be
You might want to
helpful.
talk louder. She's got hearing aid.
Yeah, can you hear me?
Excuse me?
So this sheet has some of the eye drops we recommend to treat the dryness.
Okay.
Okay?
Alright.
You can pick these up from the Publix or the drugstore.
Okay.
Okay? So I want you to use these during the day, and then you can get an ointment to use at night, and that's all over the counter. All right?
So she would rub that ointment on her eyeball?
You put it in the eye, yes. You lower the eyelid down, you just put a little bit right in that little pocket, and then blink, and it'll coat the whole surface.
Okay.
Okay, so so then I wrote everything on here as well. So let me give that to you. Do you have any questions about anything?
No. Well, yes.
Yes.
Well, these drops help me to get rid of that
I'm hoping
fogginess.
that stopping the latanoprost will help with that swelling that's in the retina. That's why we're switching the drops.
Okay.
Okay?
Okay.
So I want to see you back in a month so we can check it and see if it's getting
See
better.
me back when?
In a 1 month.
1 month.
Yep. And we'll check it and see if it's getting better.
Okay.
Okay? Okay. If the swelling's not getting better, we may have to send you to a retina specialist. But we're going to try this first. Okay?
Okay.
Alright.
A lot of the fogginess is also from glaucoma, and glaucoma, once you've had damage from glaucoma, it's not reversible. So we're going to try everything we can to get the vision better. It's not going to get back to
To where it
perfect.
was.
Yeah. But we're going to try to get it better, okay? Okay. Any questions from either?
Okay, how do I
Okay.
get an appointment with you?
They'll, when you go out, stop at the front and they'll make the appointment.
Good.
Okay? Okay. All right.
And your name is Dr.
Barnwell.
Is it on here?
Right down.
Eliza Barnwell, right?
Yes, that's correct.